We're here at our new Stop the Spread site, which is obviously taking the place of two of our great vendors that helped us out during the early days of this battle, Star and Seven Hills. Now we have a location right here, which will also be a vaccination site at Bristol Community College. They stepped up in a big way to help us. Although much of the attention has shifted to vaccines lately, I would like to take this time to urge people to get tested. We still need to keep our test machinery going in full tilt because this is very, very important. The tests that are being given behind me right now at our new partner, CIC, are self-administered tests. You take a swab, you run it around, they take the sample, and they get back to you very, very quickly. 24 to 36 hours, you'll get your results. This site is going to be open 6 days a week. Tuesdays and Thursdays, we're going to be open for everybody till 7 o'clock at night, so if you have to work, you can come down here in the afternoon. We urge you to make an appointment to get ready to go. I also want to make sure you understand how big Bristol Community College was in this whole thing, because they stepped up to help us for parking, for buildings, for facilities, and it's one of the key reasons Fall River is joining the fight to get rid of this crazy, crazy disease. But I am going to let Tess Curran, our Department of Health Director, talk a little bit about specifics. Then I'm going to introduce some of these people that are nice enough to join us here today.
Thank you, Mayor. I'd also like to thank CIC and our team on the ground here, as well as BCC, for doing all this great work with testing. And as the Mayor said, testing is critical and an ongoing process. So we continue to encourage anybody who has been around somebody with COVID, has been in a group setting, or has any symptoms to come down here to get a test. It's really critical that we continue that effort. So thank you, CIC, for doing a great job and continuing on the program here. I'd also like to take some time and talk about the vaccination efforts. As we all know, we're in phase 1 of the vaccine rollout. The distribution timeline has been created by the state. An advisory panel really established the cohorts that would be prioritized in getting the vaccine. That's all done at the state level. And I would encourage all residents who have questions about when they are eligible to receive the vaccine or where they are in that timeline, that they visit the mass.gov website and review the vaccine timeline. That indicates exactly where we are in that timeline and when folks would be eligible to receive the vaccine. It also provides information for those who are eligible where they can get the vaccine. You know, we're fortunate that we have a great partnership with BCC, and local health will be setting up clinics for eligible populations here at the Bristol Community College campus. Again, when you are eligible to receive the vaccine, it's very important that you receive the vaccine. When your group is activated, please come and get a vaccine, whether it's here at BCC or another location at a pharmacy, a doctor's office, at a mass vaccination site like Gillette Stadium or other areas. So there's going to be plenty of opportunity for locations in terms of getting the vaccine moving forward, but it's really important that people actually register for an appointment and get the vaccine. That's what's going to help us to control this pandemic. We need people to be vaccinated. The vaccines that are available right now are safe, they're effective. However, when you are vaccinated, that doesn't mean that we can just go about life pre-pandemic. We still have to be wearing our masks, maintaining social distance, washing our hands, staying home when we're sick, and avoiding, large gatherings and large crowds. So as we move forward through the phases, please continue to check that mass.gov website and continue to be mindful of your symptoms, continue to get tested, and to all the public health measures that we've been talking about for many months now. So thank you for your time.
Okay, I just want to make sure you understand the importance of being tested. If anything, that's what we can do to beat this battle. I do want to introduce a few people that are with us today. Chief Lynch from the fire department. They're still running their testing site up there for it's extremely affordable, and they have tests going around the clock also. Richard Aguiar, our director of, what is it, Rich? EMA, there you go. Nick McGann is here with us, and our police chief, Jeff Cardoza. Also with us is Joanne Bentley from BCC. They're the group that's nice enough to host us. But this doesn't happen because it emanates out of Fall River. Most of all of our big support for the city comes from Boston, and we're fortunate enough to have three tremendous legislators with us today. I'd like to let them all say a couple of quick words. They're the ones that help fund these kind of operations, and they're the ones that make sure the citizens of Fall River are safe. And when we turn to them for support, they're always right there. I'll start with our Representative Paul Schmid.
Well, you can speak, well, someone speak for all of us.
All right, go, whatever you want, guys. Go ahead.
Carole, we'll go over your district.
Oh, thanks. Paul, Mayor, thank you. Tess, Curran, thank you for your diligent, persistent work against this virus. We really appreciate it. On behalf of Rep. Schmid and Rep. Silvia and I want to thank all of you on the front line and here at BCC. One of the things we are constantly hearing are, you know, when can I get the vaccine? And you know, it's a measure of the quantity and of course the phasing. As was mentioned by our health director, we are in phase 1, and I urge everyone, and we urge everyone out there to pay attention to the website. You will know when it's your turn. There will be locations, there will be plenty of locations for you to receive the vaccine, and we are making sure of that. We are in frequent conversation with Health and Human Services, and they are assuring us that we don't have to worry about that, and that has been a worry of many people. So there will be plenty of sites to do so. On behalf of myself, Rep. Silvia, Schmid, and Senator Rodrick, who's represented here today by Caitlin, please know that we continue to be your strong partners in fighting this disease. There isn't a bigger priority right now, and we thank you for this effort. And as a matter of fact, I got tested here last week. Just to show you this quick drive up, you make an appointment, you drive up, within a couple of minutes you get your test, and I had my results online in 24 hours. They were negative, but I did have them, and it was painless and quick. So if you think you need a test, don't hesitate. Please register here. Thank you.
Sure, just quickly. It was all said, but I know that it's important that people get out. So many calls, we've received so many calls in our district office about, as mentioned, the vaccine, where to go. We know it'll be Walgreens and CVS for sure, Bristol Community College. There'll be a number of sites throughout the community, but please go on that site to check what phase you're in. That's most important. I know everyone wants to be a priority. We get a lot of calls about that. We're communicating with the Secretary of Health and Human Services, and we've been influential in moving certain categories to phase 1 and to early parts of phase 2. So we're getting people vaccinated as soon as possible. But in the interim, please come down and get a test. It's very easy. All these stories you hear about, oh, it's painful, they go up to my brain, not the case. It's painless. And it's so vitally important that you get tested so that we can stop the spread. Paul, I know, please jump in.
Thank you very much, Alan. We were so happy to see that our first responders received their vaccines last week, and they will be on target for their second shot the second or third week in February. Thank you very much, Mayor, for all you have done. Thank you for your leadership.
And no, we haven't gotten the vaccine.
Okay.
Mayor, we have not gotten our vaccine. I want to just spell that. A lot of people ask, did you get a vaccine because you're an elected official? Absolutely not.
No.
We have to wait our turn. And of course, that includes our great councilor, City Council, Linda Pereira, who's here. Linda, come on over.
You're stealing all my thunder, thanks. Yeah, no, absolutely. Linda joined us today. Caitlin joined us today. And this location is really focused on both the testing and the vaccinations. We are expecting more vaccinations shortly. I was on the phone with Lieutenant Governor this morning, and we're trying to work out ways to get more testing into Fall River right now, but she's extremely pleased that we're moving along at a very brisk pace here as far as the vaccinations go. Secondly, this location is about hope. You take a test behind us, you hope you don't have a positive result so you can continue in your life. And the vaccination will give you the hope going forward to know that we're going to beat this disease in Fall River, and I am 100% sure of that. And if everybody does what they have to do down the stretch here, I told this yesterday to one of the other reporters, it's the Boston Marathon, and we're at the top of Heartbreak Hill, and we're heading into Boston because we're going to finish this up shortly, and we just need you to stay strong. Does anybody have any questions? Correct. Correct. I think what it's going to be, Kelly, is that building right back there next to the water, Building G. Tess is going to look at it after the meeting today, but that's where we need a bigger space for the vaccinations. It will be on campus also, but you'll come around the back way. I think they're going to the other side. We're using the other side of the campus now. When we go bigger with more vaccines, we expect to move to a bigger spot. Right now there is, yes. But next week we'll be transitioning to this bigger one.
We were in the same location that you had been
Right, last week.
And we had a clinic today for congregate care and others within phase 1 that are eligible to receive the vaccine today. So we were able to vaccinate over 100 people today, and then we'll be hosting clinics hopefully next week based on allotment that we received.
Is it fair to say there's no exact date when it's going to start?
It's already started, Charlie.
No, I mean for the new one.
Hopefully next week, depending on the amount of vaccines we get. If we have what we want, we'll be over there next week. If not, we may have to pause a little bit, but they're on the way.
Well, you have to wait for phase 2 to kick in.
No, we're still doing phase 1. We have other categories in phase 1 we're going to start hitting.
So this is going to complement
Absolutely.
what's already going on.
Yep.
So who are the 100 people that got vaccinated? So it's a mix of first responders. In total, as of now, we've vaccinated about 297 eligible folks within phase 1. So that's a mix of first responders, healthcare workers, and then folks within the congregate care settings. So we're working with the EMS team, and they've been administering the vaccines. So we have a kind of internal vaccination task force, the health department, representatives from police, fire, and EMS that are all part of the planning team. And then we've had the paramedics who are eligible to vaccinating. As we ramp up, we'll likely be relying on additional volunteers, including people from the Medical Reserve Corps, as we'll need more hands on deck. So we're kind of working those numbers out with space, but ideally we'd be upwards of 300 vaccinations a day. But again, that's kind of dependent on our capacity and how we can lay things out, and the bandwidth in terms of staffing. Thanks. If individuals aren't explicitly listed on the vaccine distribution timeline that the state outlines, then they would be considered part of the phase 3 general population vaccine. So if you don't see your name or your occupation or your age demographic specifically listed, then you're in phase 3. Sure, thanks.
And I also want to acknowledge that we are going to be opening up CVS and Walgreens shortly, where again it's free vaccinations for anybody that comes in their phase. CVS on President Avenue. I'm hoping we get the others in the Walgreens on Plymouth Avenue. Anything further, guys? Correct. Thank you.